A lot of the products that we have as human beings that are just sort of around our homes in our daily lives make a lot of different components for smoke. So, if you are breathing in this particulate matter, what kind of impacts does that have on the individual? Smoke is really, really complicated, so it's hard to pull apart, which element of the smoke might be causing which particular health effect. But we know that particulate matter inhalation has been linked to premature death in anyone with a heart or lung disease that's already been diagnosed. It increases the rates of heart attacks, non-fatal heart attacks in some studies, increases the rates of irregular heartbeats. Obviously, I don't think it's going to be a surprise to anybody, increases rates for asthma or COPD exacerbations. Uh, if you have completely normal lungs, breathing in smoke will decrease your pulmonary function. And regardless of the state of your lungs, breathing in smoke leads to inflammation, irritation, you know, on milder days that might be just a scratchy throat or a cough. And as you get higher and higher levels of smoke, worse and worse air quality, that can lead to wheezing, chest tightness, feeling like you're not able to take in a full breath, and honestly some pretty significant respiratory irritation. When we look at days of where communities are exposed to high levels of smoke, all age groups have increased visits to emergency departments for respiratory related complaints. So it's not just your very old patients with COPD. It's not just your smokers. It's not just people who have diagnoses of asthma. It is across all age groups. We do see the biggest impact, or at least some studies have seen the biggest increase in ED visits for people between 19 to 64. And not all of them had any pre-existing respiratory or heart complaints. Interestingly, we've also seen a increase in the odds of like a cardiovascular visit to the emergency department, so some kind of issue with your heart, but it doesn't necessarily happen like on the day that you are exposed to smoke. It can be delayed by several days. And a separate study looking specifically, I believe, at Seattle Children's Hospital found that there was a 7% increase for hospital admission for any reason on days with high wildfire smoke exposure. Now, we do know that children can be uniquely susceptible to smoke inhalation. They have a higher minute ventilation, which just means that they're smaller than adults, and for their size, they breathe more air than a larger adult does per minute, which means that if they're breathing in air with smoke, they are getting more of that impact per pound of their weight than an adult.